Good afternoon. Today is Tuesday, July 19th. This is Public Health and Safety. We have a quorum with myself, Councilwoman Johnston, Councilman Pulley, Rosenberg, Swope, and Taylor. I'll go ahead and take the resolutions on a consent agenda. We'll just basically go in order. So unless anybody has any on the initial resolutions on page 1 and 2 that you'd like to pull off. Any questions about those? Okay. RS 2022-1648 by Allen and Evans approves a modification to the Fire Marshal's Office fee schedule. RS 2022-1649, Allen, Evans, Welsh, and Swara approves a grant from the Tennessee Department of Health to the Metro Board of Health to achieve sustained control and enhance prevention to eventually eliminate tuberculosis as a public health threat in Tennessee. RS 2022-1650, Allen, Evans, and Bradford approves a grant from the Friends of Metro Animal Care and Control to the Metro Board of Health to provide funding for the Safety Net Program, emergency medical care for shelter animals, and foster behavioral support. RS 2022-1651, Allen, Evans, and others approves Amendment 1 to a grant from the U.S. Department of Health and Human Services to the Metro Board of Health to provide for prevention, surveillance, diagnosis, and treatment of HIV/AIDS, and to administer a Minority AIDS Initiative program. RS 2022-1652, Allen, Evans, and Welsh approves Amendment 3 to a grant from the U.S. Environmental Protection Agency to the Metro Board of Health for the ongoing collection of data on ambient air concentrations for fine particulate matter in Nashville, Tennessee. Do I have a motion?
Seconded.
All right, it's been moved and properly seconded. All those in favor? Aye.
Yep.
Anyone opposed? All right, you approve. Welcome, Councilmember Nash. Do you need an agenda? Okay. All right, so we've got our consent agenda taken care of. I'm going to go to the late resolution next. And it is a late resolution by Allen and Evans approving a correction to Amendment 1 to a grant from the Tennessee Department of Finance and Administration to the Metro Office of Family Safety to fund staffing positions to help manage the multidisciplinary needs of its clients.
Second.
All right. I do have Ms. Lance here. Would you like to say anything about your late resolution, the content, or anything like that?
This is just a continuation of a grant that we've been receiving, and we got the in-kind match eliminated. And when we came through council the last session, when we returned it to the state, they didn't get their signature on the due date. And so we just need to change the effective date in order to get their signature on the correct date.
All right, thank you. Thank you. Any discussion or questions? All right, all those in favor?
Yep.
Anyone opposed? All right, and we've got now Councilwoman Gamble. Thank you very much. Okay. Thank you, Ms. Lance.
Thank you.
Let's see. I want to, Councilman Mendez, with your, is it okay? I'd like to skip just to the last one and come back to yours. The next one is BL 2022-1345, Evans and Young, amends Title 15 of the Metro Code, water, sewers, and other public services regulations pertaining to private fire hydrants.
So moved.
Thank you. It's been moved and seconded. Any questions or discussion? Councilman Swope.
Just one, and you probably answered this in transportation, but I had to come here and then wait for a quorum. What does this actually physically change between the existing laws and what does it do?
So the way it works now is Metro Water, we still enforce them. It's still under the Fire Marshal's office if they're not working and they need to be, we enforce that part of it. But Metro Water has to schedule and get them repaired. They have a contract that they do, and they call and actually set up the repairs of each one of them, or schedule the testing of each one of them.
And that's what's current.
Yeah, and so what it's doing is it's putting it all to us and to the Fire Marshal's office, and what we're doing is we're letting the business owner provide whoever they would like that's a licensed or certified, locally certified plumber or sprinkler installer to be able to go any route they want to do the testing and maintenance.
So
inspection, testing, and maintenance.
So for somebody who knows absolutely nothing about fire hydrants other than, they're red things that are heavy and smash your bumper when you hit them, this is basically deregulating this to some degree, is it not?
No, sir. These are private hydrants. The red ones you refer to are the public hydrants. The Metro Water will.
No. Forgive my little attempt at humor. we're actually deregulating this to the point where the water department doesn't have to set inspections, but the private owner can set an inspection based on a certified plumber.
No, sir, yes, but that was, we're still the ones that enforced it, so we're doing it with a third-party vendor through the reports that get sent online. We've actually tripled the amount of reports for all systems by using this third-party vendor to keep everybody in compliance. So everything should stay the same because the information of it's time to check your system is still going out. It's just not being done by Metro Water. We're overseeing that part of it now too.
And do you guys have the capacity to do that? I mean, is this going to create a workload problem for you guys?
The workload isn't any different because we still enforced them even if Metro Water didn't. Even if Metro Water were scheduling if there was a problem, we still enforced it, whether it be with inspections, whether it be inspections, citations, follow-up inspections, whatever it took. So the workload for us, the only thing that changed for us is the way the way the reports are being submitted. Before it was all paper, email, whatever. Now it's a cloud-based system. You can call and request a record on any private hydrant, and we'll be able to find it in a matter of 10 minutes instead of half a day.
Yeah. All right. Thank you.
Yes, sir.
Any other questions? All right. Any other discussion? All right. So I will renew my movement for approval. All in favor?
Yeah.
Anyone opposed? Okay. Thank you. And then we'll go to BL 2022-1115, Mendez, Rosenberg, Allen, and others. Amend Section 13.08.080 of the Metro Code pertaining to the use of license plate scanner technology to exclude assisting with immigration enforcement as an allowed use of LPRs.
Second.
Okay, it's been moved and seconded. Councilman Mendez?
So as a reminder, this came up for the first time, I think, in February, and in my request, it got deferred so we can get past the budget process, get past the big July public hearings. Because it's been more than 90 days, council office tells me that under Rule 43, it needs to be automatically deferred one meeting. So I do plan to pursue it, but it'll have to be at the next meeting because it's automatically deferred under Rule 43.
Can we also delay discussion, or are there people here is that why everyone's here? No? Okay.
All right.
If we're gonna have the discussion in 2 weeks, we may as well have the discussion in 2
I'm happy
weeks.
to do it either way.
Okay. We can go ahead and move for deferral.
So moved. Yeah, right.
Yeah, it's deferred by rule. Okay,
No
there we go.
action taken.
All right, thank you. Thank you, Councilman Mendez. Okay, before I recognize our guest, I want to remind everybody, next Tuesday, July 26th, 4 to 5:30, council chambers, our special called meeting on fentanyl. This one's important because we're trying to transition from awareness to action. MNPD has asked for our help in disseminating information to our constituents. Sergeant Mike Kotz from MNPD, who's the head of the Special Investigations Division that investigates drug overdose deaths, is one of the speakers, and he's really looking for support from our body. The Board of Health, I had the opportunity to be recognized last week at their meeting, and there's the Board of Health Chair will attend, and some other folks from the Board of Health as well. So if you're able to attend, we would greatly appreciate it. With that, we have a special guest today, General Funk. Thank you for being here. We tried to coordinate this a couple months ago. It didn't work out, so thank you for being here, and I'll recognize you. I understand you have some stuff to share.
Great. Let me first introduce David Jones, Assistant DA, who's actually our Director of Community Outreach. Also got Lydia Page with me. She's an intern. She's a law student at North Carolina Central. She's a rising second-year law student, and she's doing a great job for us this summer. Interns, while they're in law school, can oftentimes take jobs with firms and make a good amount of money. As a government agency, we don't pay our interns, and so she's doing all this just because she cares about learning how to support our community. So I appreciate her service this summer. I'm not here to make an ask. This is more informational. One of the topics that has been dropped in the lap of the criminal justice system is homelessness. The state legislature recently made it a felony to camp out, as if maybe there would be a deterrent value of having a felony if you are homeless but then how in the world are you going to get housing if you have a felony conviction? Right? I mean, it's kind of one of those issues where, the cure actually kills the patient. So, but now it's been dropped in my lap, and everybody comes, and Glenn, what are you going to do about this? And Metro National Police Department has not made any arrests under that statute yet. But there's a lot of discussion around it, and I don't think as a city we've had a real discussion about homelessness issues. We talk about it, we paper it over, we kind of kick the can down the road. As the district attorney, I have very frequently said I do not prosecute poverty. I don't. It's not something I want to put people in jail for just because they can't afford housing. But I think just the average Nashvilleian might say, or the average American, because there's issues in every city across the country, would say, well, people are homeless because they got a mental health issue or because they recently lost their job. But that's not really who makes up our homeless population. And certainly those are two factors, and a percentage might have that. If you ask Jay Servais, who works for the mayor, he's kind of the homelessness czar, he says that only 7% of homeless folks would refuse supports and transitions to permanent housing, or at least to quasi-permanent housing. Lindsay Cranks would say that, from Open Table, would say it's even less than that. If you'd ask other folks, he would say it's more like 80 or 90% would refuse that housing. And so among the things that I am doing as a district attorney now that this is in my lane, I try to stay in my lane, right? I'm the DA. I'm not a council member. I'm not the mayor, right? I'm the DA, but people put this stuff in my lap, so by golly, I want to do some work on it. So I've already met with Lindsay Cranks. I'm going to meet with Charles Strobel. I'm headed to Detroit next week for a meeting of the American Prosecutors Association, which will be about 35 of the biggest 50 jurisdictions, including Portland and Chicago and New York, and a variety, to talk with them about how, what solutions they're trying to have to bring back some best practices. I've met with the folks at Reclaim Brookmead Park. I've talked to folks that have some issues with what they consider enabling at Centennial Park, our flagship park. I've made the walk with an assistant district attorney and some police officers through Hall of Fame Park and through downtown on a Friday night. I'm trying to get a feel for this because when I took a walk through Brookmead Park, I had 3 of our office investigators, former police. I had 3 police officers with me. I had some other folks with me. We go walking through that park, and there were literally over 200 tents down there. And as I approached the river, for y'all who've never been there, it's kind of by the Lowe's and behind the Bojangles, kind of near Nashville West, but on the other side of the interstate. And it's a beautiful metro park, right? And it's a paved pathway that descends down into a wooded area, and then you get to the Cumberland River, and the path takes a left, and then you get to an observation platform that looks out of the water. It is beautiful. But when I made the walk, middle of the afternoon, it's essentially a series of neighborhoods of campsites, and when I got close to the river, somebody stepped out from behind a tree with a baseball bat and took 5 or 6 steps toward me until he saw that there was a big entourage and just kind of mumbled about how it was his baseball bat and wandered off. And I'm sitting there thinking to myself, what if it was a mom who had just recently moved to West Meade and sees that we've got a public park and had a 2-year-old and a 4-year-old in a stroller going through there and didn't have a bunch of police officers and criminal investigators? What kind of safety issue is that? And I also thought about, well, you know what, every place that we have in Nashville, you've got police protection, fire protection, codes that you have to live up to. And the folks that live in this encampment don't have any of that. I mean, they've got a little bit of police protection, but it's not like there's a regular beat. There's not like somebody can drive through there. So we're not serving that population of folks. We're not helping with the quality of life of the surrounding community. And what are we going to do about it? Because at some point, somebody's got to come up with a real plan to help folks. And one of the things that Lindsay Crink says is, you don't just need housing, but you need a counselor that can help them as this transition. I think a lot of the difference between people who think 80% would not take help and folks that say only 7% would not take help is, once someone has been in that lifestyle, whether by choice or by circumstance or by drug addiction or by mental health or whatever, once they've been in that for a while, it's hard to break out of that cycle because that's not kind of where you are personally. And so you have to have not only housing, but you got to have counseling, you got to have job skills, and you got to have job training. And, what are we going to do about that as a city, right? Don't just ask me to incarcerate our way out of this, because I think that's a losing proposition, because if we don't provide any supports, as soon as they get done with whatever jail sentence, they're right back under the bridge, or they're right back Brookmead Park. And it is a real problem. But it's also a real problem for the neighborhoods. And then, as recently as this morning, I got word that there has been a series of assaults in the Central District of folks that are homeless by primarily young people. And we want to de-escalate the situation instead of escalate the situation. So this is really kind of more informational. I am going to do this comprehensive study. I want to continue to talk to J Surveys, and I want to come back and tell y'all some potential options that we have, that maybe there will be a role for prosecution on some, but maybe if we do the things that we do so well in Nashville, then maybe we can actually set the gold standard that the rest of the country can follow. We're already doing that with our behavioral care center. We're already doing that with the way we support victims of domestic violence. We're doing that in so many other different areas in Nashville for the whole of the country. Then maybe we can pull certain best practices and then come together. But I'm going to be coming back to the council and to the mayor's office and saying, here's what I found, here's what I think the situation is, and here's what I would suggest we do going forward. But it's going to require the council being able to engage in a very real discussion about how much resources do we want to invest as a city. I do think that in the long run, if we get this handled in the correct way, then we'll end up saving the city and saving the city money and making ourselves a better city. The other thing is fentanyl. It is a real drug sales in the downtown are a real problem. It has gotten to a point where if you are standing in line outside of Honky Tonk Central or Kid Rock's, people are going to come up to you and ask you if you want a party pack. And in that party pack, you might think you're getting some Xanax, or you might think that you're, getting some cocaine. From the reports I've gotten from the police department, all of it's at least laced with fentanyl, and fentanyl is so cheap and the pill presses are so easy to use that sometimes they get nothing but fentanyl in what they think they're buying. And that's a real problem. I've talked to Commander Bearden. He has recently started being more aggressive on the buy busts down there, and every one of their cases that turns into a buy bust, we don't just send through the regular courts. Ed Ryan and Mindy Vinecore, who are our special ops prosecutors who do the major narcotics prosecutions, they're taking those cases. They don't go to the rank and file DAs. And we've pretty much got, you can't in a criminal justice system have a zero tolerance policy, because every case rises and falls on its own facts. But we've got folks in their charges to take any drug sale where you've got a buy-bust situation with the police, especially if it's fentanyl, which at this point now has about 100% of these. Take that very seriously, and we cannot continue to have visitors to our city approached, and maybe that bridesmaid party might not be going to use drugs until all of a sudden it gets offered to them right there. My understanding is also, not just from the police, but from some of the defense bar, that a lot of times the folks that are selling the drugs will enlist folks who are homeless to be the ones that approach the people in line which stinks, because that person's gonna be much more likely to take a small, a pittance for doing this horrible crime. But, our policy is, we don't prosecute poverty, but by golly, we will prosecute somebody who commits a crime. And so, that might be a mitigating factor, but it's still, they're selling the substance that contains fentanyl, and we're taking it very, very seriously. And so I wanted to report that to y'all. And then, as y'all address fentanyl, whether it's 2 weeks or 4 weeks from now, I'm certainly more than happy to be a part of that conversation, and I can bring the DAs that are handling those cases with me too, to sit at the table and have a city, kind of a all stakeholders discussion on how we're going forward.
Thank you. What questions do you all have for Chairman Nash?
I don't know if they have so much a question, but since I've been here, I've been kind of pushing the Westlake project that came out of Seattle. I was introduced to it by a bunch of federal district attorneys at the meetings we went to, and we talked about the intervention program. But literally, they did an analysis of their high users of arrests, medical injuries, and at the time, that was said, no, they won't come. They built something like housing for 70 people with all the wraparound services about it, and they allowed folks to use their alcohol or whatever as long as they weren't causing problems. Only one person turned them down, and they saved several millions of dollars every year because they weren't jailing them, they weren't having to go to the emergency room. And I know we've got a somewhat similar facility being built, but I hope we might see a little bit more of that, because
Dan Satterfield from Seattle should be at that conference next week.
I'll send you the details on it and the evaluation that was done by JAMA.
And then Mike Schmidt, who's the DA in Portland, Oregon, is going to be there as well. And of course, Oregon has done a lot with this complete decriminalization, but then they're also seeing their drug use go up, like a lot. And so I'm going to be picking his brain about, different causes and effects, and especially, because they both have very similar jurisdictions. And so, I'm going to try to do some comparison and contrast and be able to report that to y'all as well.
Councilwoman Johnston.
Thank you. I'm really encouraged that you're here and engaging in this, and I know it's been dumped in your lap, but I feel like if we're really going to, as a city, address this, everyone has to be on board. Everyone in the judicial system, everyone in law enforcement, us, the public, because it's an all-hands-on-deck problem, and it feeds through sort of the system. And so if one link of the chain is broken, then we're really not doing much. I also wanted to point out, we're talking about drugs, but the human trafficking aspect within the homelessness population is phenomenal. And it's not just happening in our encampments, it's happening in our rapid rehousing that we are funding. I have not personal experience with it, but I'm helping with people, and so I hear about it regularly, and it's just alarming that that's happening under a roof that we are providing. So I'm hoping that we're gonna look at that too, and I think, we're the COVID-19 Financial Oversight Committee has approved or making a recommendation for $50 million to be allocated towards this problem. I'm a little hesitant that only $9 million of it or so is for the wraparound services, that I think that's what solves the problem. What I asked out of that $50 million or the 49, how many units are we talking about? And I was told 90 to 120. And when we have a population of over 2,000, we have differing opinions of the numbers as well, but when we have that type of a population, it's a little discouraging to hear that at some point in the future, because they have to be built, we'll get 90 to 120 units. That's really not going to do a whole lot. What will help people are those wraparound services, the counseling, bringing people back into a normal way of life and not living on the street and dealing with their addiction, dealing with whatever underlying cause that has put them on the street in the first place. So I guess I'm cautiously optimistic about that. We do have funds that aren't coming from our general fund, which is good. But I just really appreciate that you're here and that you're taking such a comprehensive look at it, and that there are obviously all kinds of different perspectives of it. There's the perspective of the person that's experiencing it. There's the perspective of the mom with the 2-year-old that wants to be able to enjoy the home. There's the perspective of the businesses that are being affected in a negative way. And then there's people that are looking at it from a very humanitarian perspective, in that this is sort of where they are in their life, and we need to be respectful of that. And to a certain degree, that's the truth. But what are we allowing? Because we're allowing a lot of abuse. We're allowing a lot of human trafficking. A lot of, they're not living well. In my opinion, we're not doing them any favors. So thank you that was a long way around.
So, one group that I've talked to has identified a plot of land out near John Toon Airport that we could put tiny houses on, and then, maybe have a bus spur come off of Charlotte, and then be able to have some transportation, and then it'd be easy to police, and it'd be easy to have fire and codes, and be great. I also talked to a major developer in town recently, who I'm not going to name at this point, unless this person says I can use their name, about that, and the developer said, yeah, but what if we, instead of having all that land, what if we built a tower and essentially diagrammed it out on a napkin to, have 7 or 8 units per floor, and you could have essentially what's similar to a resident advisor from our college days, an RA who would know everybody on their floor, know who's supposed to be in the rooms, know who's not supposed to be in the rooms, be able to check in with those folks every day. How are you? Are you on your medications? Did you make it to work today?
And access points are limited as well.
Yes, and so that's something that certainly I want to explore, but I was encouraged by the fact that every person I've gone to, even the folks that, part of the problem is that some of the folks in the neighborhood groups versus some of the folks that are the advocates, they're talking at each other because there's a lack of trust on both sides. So, but every person I've gone to has been willing to participate in this discussion, and so I'm actually fairly encouraged, and I hope to be able to, because I think everybody in Nashville realized, you'd be surprised the number of calls. I got a call from a dentist this week saying, listen, I've got this dentist office out at Old Hickory of all places, and there's this homeless camp in the woods near the rail line for the Star, and everybody then comes out of the woods and they're essentially plopping on the dentist's front step, and so it is something where, heck, Gary, you've probably seen it even up in Jolton now. I mean, Jay said there's over 100 different encampments, and you're right. We need to be better about supporting these members of our community, but we also need to be cognizant of the fact that it's also about quality of life for everybody in Nashville. And if we're going to, I don't think any of us want to just set up an autonomous zone and just have that, because that's not good for anybody. And so, as a city, we need to have this discussion, and we need to have it in a place that's a safe space where people can work together for solutions. And I'm going to try to facilitate at least parts of that discussion, and I hope to be able to work with this committee and the entire council going forward.
Councilwoman Campbell.
Just wanted to make a clarification, a statement about the $50 million for homeless that was approved by the ARP committee. $25 million is for housing, transitional housing, rapid housing, and $25 million is for the wraparound services, reentry services. I'm encouraged that you are meeting and having discussions with social services and other groups, and would hopefully, as this $25 million for wraparound and reentry services becomes available after the council approves this recommendation from the committee, you get involved, your office gets involved with social services, MDHA, and the other partners that are helping leading this effort, and being a part of that solution with that $25 million that we have designated specifically for that. So I'm encouraged that you're having those discussions, and as we get these dollars approved, we need to make sure we get you all together with them to be a part of that solution.
Looking forward to it.
Councilman Mendes.
Thanks for letting me talk, even though I'm not a member of the committee. Thanks, General Funk, for coming today. Really, 2 quick comments. One is, I very much appreciate you and your office stepping forward when there's the sort of vacuum that you described. I hope we get to a point where the mayor's office is taking the lead, fundamentally, while pretty much every idea you've talked about I'm by and large in agreement with. As you know, for a lot of the folks who are out on the streets, the idea of somebody who's fundamentally law enforcement leading the conversation is off-putting and challenging. Same with advocates. And so I look forward to the day, hopefully, where this kind of leadership comes completely from the mayor's office and you get to be a participant rather than leading the discussion. And then, and you don't have to respond because you're just going to say they're doing a great job, which I appreciate. But I don't see them here. They're not part of the conversation, so you don't have to.
You're doing a great job.
And then my second comment is really just a thank you from one countywide elected official to another, that your willingness to be firm when things get dumped in your lap, whether it's abortion, criminalizing homelessness, immigration issues. You have been strong in doing that, and it's as I think I feel brotherhood with. It's not to pick a fight. It's to let people know statewide and in the city that there is a difference of perspective on values, and you're expressing the values of the people that you represent. And this body, unfortunately, when it comes to reproductive rights, is now having dumped in our lap. There's going to be times where we're going to have to take a vote on how the outlawing of abortion in the state of Tennessee impacts Metro. We're going to have to take hard votes on that, the same way that you've had to say hard things and give the appearance of picking a fight, even though I know you're just representing the people. And ironically, that's why I'm pursuing the LPR thing that we're going to talk about next time. Is it's important that we express the values the same way that you've expressed the values on those important issues. So thank you for doing that. I hope you keep it up.
All right.
Thank you.
Any other questions for General Font or his team?
All right, great.
All right, thank you very much for
Good to
being
see
here.
y'all.
With that, we're adjourned.
All right.
Get that.